Some really exciting news for women's health came out this week. My producer, Krista, and I were especially interested in this news and wanted to both jump into this conversation. We had a chance to sit down with a local doctor to dissect what these changes to HRT therapy mean for women like us. Hormone therapy for menopausal women is shaking off a decades-old stigma. The FDA says it's lifting a warning on HRT treatment, now making it more available to millions of women. Now, this is a big deal.
It's a really big deal, and here to help break this down for us is Dr. Sarah Foster-Racina, director of UPMC Magee Women's Midlife Health Center. There is a reason I was meant to be here today, and it is this conversation right now. A lot of our viewers know hormone replacement therapy. Maybe they use it. For those who don't, what does it treat?
So hormone therapy is referring to estrogen and in some cases progesterones or progestogens to address symptoms of menopause such as hot flashes, night sweats, sleep disturbances. It's also used to prevent bone loss, osteoporosis prevention, and genitourinary syndrome of menopause, which refers to a constellation of symptoms related to low estrogen in the genitourinary tract.
Yeah, so it can be used for so many different things and treat so many things that we go through as women. Now, this warning, it was placed on estrogen back in the 90s. Why was it scrutinized by so many doctors? This all stemmed from a really big trial, right?
Yeah, so the study actually was initiated in the late 90s, and then early findings came out in 2002, and then they added the warning based on those early findings that, you know, they cited increased risks of cardiovascular disease, breast cancer, stroke, dementia. But it's important to look at the study. It was intended to study those for older women.
I see.
And so, you know, the unfortunate issue is that they only looked at one formulation, one route, one dose of hormone therapy, but it was applied broadly to all formulations of hormone therapy. And the average age of the women in that study was 63. Women aged between 50 and 79, some of them far from menopause.
Exactly.
And the average age of menopause is 51.
Yeah.
But the issue was that they really overgeneralized those risks to all women.
Yeah, so it looked at a real small subset of women, and then therefore it made women afraid to take it, and doctors are afraid to prescribe it.
Absolutely, yes. So what happened was, I mean, overnight after this news came out, at the time, 1 in 5 women were using hormone therapy. But overnight, prescriptions plummeted by almost 80%.
Wow.
To fewer than 5% of women using hormone therapy, and that has persisted for decades now. We're still at that rate.
Yeah.
And when the FDA commissioner sort of lifted this, I guess almost like this, we feel like permission, you know, all of the destigmatization, said maybe one of the greatest screw-ups of modern medicine. That is a big, bold statement. Do you agree?
I do.
Oh, wow.
It set us back for decades. And the number of women who were impacted then and now is huge. Almost 50 to 70 million women went through menopause in the last 20 years without the option of hormone therapy.
And I know so many women do use it now, and it sounds like more will start to use it. So there are still risks for using HRT, as they call it. What are some of those risks?
So like any medication, there's risks. And it's important to consider someone's personal health history, their age, their symptoms, as well as what kind of hormone therapy formulation. Certain formulations, for example, oral estrogen versus transdermal in form of the patches and gels, can confer lower risks. So it's important to discuss those considerations in thinking about risks and benefits. But what we know now is that women who are younger than 60 or within 10 years of menopause, the benefits far outweigh the risks when it comes to hormone therapy use.
In summary, if there's a way to just wrap everything up, what does this mean for the bigger picture of midlife care? This is a celebration, right?
It's huge. It's monumental for midlife women who want to access care. I think it's going to destigmatize, break down barriers, really move us from fear-based avoidance to evidence-based personalization.
Oh, thank you so much. This has been an amazing conversation. I learned a lot, and we'll be right back.